everyone, I'm Shannon from Nursing Education, and I'm here today to show you how to draw a urine specimen collection from a Foley bag and from a Midstream collection. This skill could be provided by any unlicensed caregiver. So we're going to first start with talking about our supplies for the Foley bag collection. So over here we have an alcohol prep pad, 2 patient labels, 2 tubes. One is the culture tube, which is gray, and one is the urinalysis tube, which is yellow. A male Lurlock adapter for the Foley. You're going to eventually get your Rex, which will be out on your nursing unit, and then non-sterile gloves. Of course, you're going to start with all the same steps that you normally do on your checklist, so please refer back to those. And we're going to start with just the skill. So I foamed in, and I'm going to grab a pair of my non-sterile gloves. We're going to go over to the patient and prep the area so that we can collect urine in the Foley drainage bag. So I'm going to pull back the covers just enough so that I can work with the Foley bag. And you're going to make sure that the tubing is not kinked on the side, so it's going straight down into the drainage bag, which is down here on the side of the bed. I want to make sure that it's all draining, so I never want to pull the Foley up above the bladder like this. Never want to do that, or any higher even than this. We want to keep it all in the bed. So in order to do that, you can push down on the sides so that gravity is pulling the urine back into the Foley collection bag down here. Once I've done that and cleared the line, then I can come over to my Foley line and I'm going to clamp for 15 to 30 minutes. So on every Foley bag, there's a clamp piece right here. And we're going to actually use the blue piece, and that's going to occlude the line off. So you want to make sure it's about a foot from the top of the clear tubing to where the clamp is, and you're just going to bend the tubing like this and get it to lock in place. And yes, it is a little difficult at first. And then you see that there's a kink there. Now we're allowing for the urine to flow right into this area, and it'll let us draw a sample from there in 15 to 30 minutes. So let that sit. You can cover the patient back up. I'm going to take off these gloves, and then I could walk out of the room and of course foam out. After 15 to 30 minutes, I'm going to come back in, foam back in, put on new gloves, and I'm ready to draw the sample. So I'm going to draw back the gown again, or the blankets again, and I'm going to come over to the actual Foley. So up here you'll see that there's 2 ports. This top port you've already learned with, or you will learn with the DC Foley, that the balloon saline is going in there. So we don't want to use that. You want to use this other port that is actually for specimen collection. So I'm going to take my alcohol pad, open it up, and wipe down the port on all sides and the top very vigorously for 15 seconds. I'm going to allow that to dry for 15 seconds. And then I'm going to grab my male Lurlock container that's sterile here, and I'm going to open up the packaging so that it remains clean. So that's how you're going to open it. And then you just touch the outside of the container. Don't touch the inside at all, because you may contaminate the sample that way by touching part of the needle. And inside it's pretty sharp in there. So I'm going to take the bottom part of the needle, or of the transfer device, and lock it onto the specimen port by pushing in and turning clockwise to the right. You'll feel that it's locked, and then I'm going to keep my left hand or non-dominant hand holding the tubing like this, and I'm going to grab my tubes. So the first tube you always draw is the gray tube, which is the culture, and I'm going to just stick that in and press down, and you'll feel it connect in there. You fill this up until it stops filling, which it's a vacuum, so it'll stop. Invert that 6 to 8 times. I'm going to put it down, and then same with this yellow top. Fill that up. I'm going to invert 8 to 10 times, and then I can take this off, and this is going to go right into the sharps container. I'm going to put it down for just a second. The main important piece now is to make sure that you unkink this tubing so that the patient does not have backflow into their bladder. That's going to go back, and we're making sure that there are no kinks on the bed and it's free flowing into the bag, and you can bring this back down. Then I'm going to come over here to where my labs were, and I want to double check the labels again with the patient. So I'm going to go back over in front of the patient, dual check that they are indeed the patient, double check with the identifiers, and then I'm able to put them on the tubes, trying not to cover up any of the barcoding on the actual tube. You also want to make sure that your name or your date, your time, and your employee ID number is on here as well. And then you can put these in the biohazard bag with your requisitions and send them off to the lab. Now, I'm going to take off these gloves because we're going to do another caveat to the skill. So we're going to take those off, foam our hands, and then I'm going to come over to this little section that I have for midstream collection. So you can follow the same steps that I basically did in the beginning and the end for sending off the specimen, but I'm going to show you how to acquire it from the cup. So the first couple things that you'd make sure you do is either provide pericare for the patient, which you can refer back to those videos, or you can instruct the patient that they need to do pericare before they collect their specimen in their cup. So again, refer back to those videos for the instructions on that, but then if you're instructing the patient to fill, or you're filling from the patient, then make sure that you get at least a halfway to 3/4 full cup. And then you can set it down, of course wearing gloves when you're in the bathroom with them. The other supplies that you're going to need that are different from the first skill are the specimen straw, and it'll be in this bag, and then you're going to need the tube still, and requisitions and your labels the same. So I'm going to foam, I have my sample in that cup, foam, put on gloves, and I have it open here on my barrier. I'm going to take the straw and not touching anything, open it up so I can just touch the outside of the barrel. It's really important not to touch the straw itself because that's going to go into the specimen and you could contaminate the sample, and not touching the inside of the barrel because you could contaminate or hurt yourself with the sharp needle that's there. So just touching the top of the barrel, I'm going to dip this into my urine sample, not touching the sides or the bottom, and then I'm going to start with my gray tube again, put this in, let it snap, you'll hear it click and connect, and it's going to fill up on its own with that vacuum device. You can pull that out, invert this 6 to 10 times, and then your yellow tube. It's going to also vacuum fill, invert 6 to 10 times. This is going to go into the sharps container, and then this you can throw out in the toilet, and then throw this in the trash. And then the same method of labeling is going to happen again, just like you did with Foley. You'll take these to the patient's bedside, make sure it's the same patient again, and then put the labels on with your date, time, and employee ID number. All right, thank you.